Good morning, everyone. Buenos días con todos. Bonjour, mon amis. So, please, imagine a world where HIV prevention is transformed into an experience. Just think about it. One that is highly immersive, interactive, and impactful. Welcome to Open Arms.
In today's world, there are many challenges and limitations on people who need reliable sexual health information. Stigma and lack of access of appropriate and validated information continues to hamper HIV prevention efforts. As an HIV counselor in a county with one of the highest HIV rates, I have encountered people like Joe, a 20-year-old young male who likes to have unprotected sex, who likes to go to clubs and uses drugs. However, it's afraid of going into a clinic and being seen and talking to a person about his personal life. But providing a place to find accurate personal information from a trustworthy source in a discreet, confidential environment is how Open Arms can help people like Joe overcome those challenges.
Open Arms is a safe and secure platform leveraging device-agnostic technology that can be used anywhere, anytime. The platform will include double encryption and will comply with HIPAA legislation. We envision a gamified, immersive experience where mentors share advice and guidance about sexual health and health preferences for people like Joe.
Open Arms is unique because it's dedicated to sexual health, which is important to us as clinicians. We know there's HIV is treatable, but we need that urgency to get testing, to get to mentor our patients. And because about 90% of people in the US have a smartphone, the technology access, the platform is right in your hands. And for those more tech-savvy, VR headset and smart glasses will provide an even more immersive experience. However you plug in, you'll be making connections in a safe and friendly environment and getting validated information, powered by collective human intelligence. Let's take a look at the demo storyboard. So right there, you can choose the language, any English, Spanish, then you can choose your avatar, and then however you identify yourself. And then, because we're talking about something very important to us, you want to feel comfortable. So then you're going to choose your mentor and the voice. Which one feels you more comfortable? So then, right away, you will be connected to the AI mentor. And then based on the conversation, our AI mentor will offer either an AI experience of a live mentor, which is what we're looking on this storyboard. Then what is PrEP? You start getting more information about that.
Okay, so now that you got a view of our demo, who will benefit from the Open Arms experience? 100,000 people working in the sexual health industry and more than 121 million people lack quality healthcare access, and more than 158 people who don't know their HIV status. As healthcare professionals, we look forward to a day where we can say to cut STI cases down from 20 million in a year.
Open Arms is building a community of learning to power the next generation of AI and live providers. With the gamified experience, CBOs and service providers will expand their client base, grow their businesses, and individuals can earn CEUs to build their professional resumes. Meanwhile, users get to explore their sexual health in a safe space, personalized for their needs from an ever-growing human-powered knowledge base.
Our sustainable and strategic business model will allow any forward-thinking organization to buy into the platform, build and validate content, and be part of the next generation of healthcare technology. The platform can also be used for free with upgraded options for more features, such as providing live mentor and earning continuity.
So for a minimal bio estimate of 100,000 for research and into legislatively technical requirements to build our BRI prototype, we recognize the needs of the platform to be secure and information to be vetted and accurate. Not only because this is a platform that promises, also because we're public health professionals whose number one concern is the health of the people who we serve.
Thank you for joining us on this journey and for giving us 10 extra seconds. Together, Jesus Medina, Virginia Munoz, and myself, Christina Bontempo, bring more than 50 years of experience in building HIV health, public health partnerships, prevention initiatives, and planning for the future. Helping people with HIV is our passion, and we believe Open Arms will be a game changer for HIV prevention and sexual health across the globe. Welcome to the future. Welcome to Open Arms.